Floss and alternatives. Flossing is important because it cleans plaque and food debris from between the teeth where toothbrushing cannot reach. Floss is the only tool required for flossing. There are a variety of flosses available commercially. If the spaces between the teeth are wide, something as simple as a fine knitting yarn can be used for flossing. Here are some guidelines for effective flossing. When you are flossing a resident's teeth, remember to use good positioning so that your back, neck, and joints are comfortable and you have a clear view of the mouth. Take about 18 inches of floss and wind it around the middle finger of each hand, with about 5 inches between your hands. Pinch your thumb and index fingers together on the floss and leave about an inch between your two hands. Glide the floss between the resident's teeth. Hold the floss snug to the tooth and make a C shape around the tooth. Slide the floss under the gums. Use an up and down motion along the side of each tooth. Pull the floss out from between the teeth. With a clean section of floss, move to the next tooth. If the floss shreds, you may want to use a waxed floss, which will slide between the teeth more easily. Flossing technique will improve with practice. Gums may bleed at first, but with regular flossing and brushing along the gum line, this should stop within a few weeks. Whenever possible, a resident should be encouraged to floss their own teeth. For residents with limited motor skills, floss can be tied in a knot to make a circle and looped around the resident's fingers. This may make it easier for them to floss without assistance. If limitations prevent a resident's teeth from being flossed the traditional way, there are aids such as interdental brushes, interdental tips, floss handles, and dental toothpicks. Interdental brushes have large handles which make them easier for residents to hold. They have small heads that fit between the teeth and are cylinder in shape. They range from small, medium, or large in diameter. These brushes can make it easier to access in between the back teeth to keep them clean. Brush tips are usually disposable, while the handles can be used for years. These handles should be rinsed after each use. There are some interdental brushes that are completely disposable, meaning when the brush tip is worn, the whole brush, including the handle, is disposed of. Interdental brushes can be dipped in mouth rinse or have toothpaste added to help clean between the teeth. These brushes should be maintained the same as a regular toothbrush. Interdental tips are usually made of rubber or plastic. They are usually attached to the end of a toothbrush handle. The soft, pliable rubber tip is usually preferred because it fits between the teeth more easily than the plastic tip and is gentler on the gums. Interdental tips are used to remove plaque and debris from in between the teeth and below the gums. They are also used to stimulate the gums. Proper use of an interdental tip involves tracing the tip along the gum line and in between the teeth. Be sure to rinse off the tip after use. Dental toothpicks have been used for many years, and the residents may still like to use this product. Typical wooden toothpicks are good for removing debris, but specially designed toothpicks for dental use are also available. These toothpicks, called interdental cleaners, go by many different names such as dental wood sticks, stimulants, dental picks, soft picks, or go-betweens. They are usually made of wood such as birch, which helps reduce splintering. Some dental picks also have sweeteners or flavors added such as xylitol or mint. They are about 2 inches long. The shape is designed to allow them to fit into the spaces between teeth. To use an interdental pick, push the pick gently between the teeth and rub it up against the sides of the teeth to remove food debris and plaque. It is important to do this gently to avoid trauma to the gums. Picks should be discarded if they show signs of breaking down or splintering. Floss handles come in different shapes and sizes. They can be used with residents that have limited dexterity and can be used with only one hand. All have some type of handle with floss attached. There are floss handles where only the floss is removed and discarded after use. The handle should then be rinsed thoroughly. Disposable floss handles are also available. These should be discarded once the floss becomes broken or frayed. This often occurs after one use. A handle may allow some residents who could not normally floss on their own to floss more easily. Also, when using a floss handle, the care provider does not have to place their fingers in between the resident's teeth. Proper technique for using a floss handle involves placing the floss in between two teeth on the biting surface and gently pushing the floss into the space between the teeth. Once inserted, pull the floss towards the side of one tooth and rub up and down to remove any debris on the surface of that tooth. Then push the floss towards the opposite tooth and use the same technique to clean all surfaces between the two teeth. Move to the next tooth and repeat for all surfaces.